the other important things before you start treatment, as well as marking out, assessing and understanding where and what not to treat, is understanding how much product you need to use. In Kelly's case, I've identified that we will need a minimum of 2, maximum of 3 syringes of RHA4, which I'm going to use exclusively. Because of Kelly's leanness and her size, we don't need to use Ultra D. In previous cases with other volumizers, I've experienced, because of the dispersion of the product, that I may actually have tended to need to use more. And in Kelly's case with other products, I may have considered using 4 to 5 syringes. So immediately I'm getting a reduction in what I think is the amount of product we need to use in one sitting. Bearing in mind, sometimes a second sitting may be required to really refine and get the best outcomes. So we're going to start off by treating Kelly's temple. I've marked out exactly where we're going to treat, but I've also identified that there are a number of veins sitting all over the temple. So although these are very superficial structures, the things I want to avoid, but sometimes can be very difficult to, and you've got to consult your patients, say that there is a risk of bruising in these circumstances, which Kelly understands. So I've marked it out. Cleansing is absolute key. Now in Kelly's case, I'm going to try and keep the line for the superficial temporal artery as much as I can, just so I know it's always there. I'm going to go just anterior to this line, and again I'm using RHA4. Okay, so I've identified all the veins, and the important thing with anywhere is that you're stabilizing your injection as much as possible. Now with the temple, keeping the needle still, I'm also going to place a finger posteriorly because I don't want the filler to migrate posteriorly, and I'm going to inject to 0.3 syringes. Now what I can see amazingly with the RHA4 is at 0.1 I can already see the difference. And I'm injecting very slowly all the time, watching the area that I'm treating. I'm actually going to go to 0.3, coming out very slowly. And immediately, even though I don't see any bleeding, I'm going to apply pressure just in case I've skewed a very, very small vein at a deep level. Important thing is here, you don't want to apply too much pressure because you don't want to risk molding your product posteriorly. We want the product in the temple to sit anteriorly to achieve the volumization of the deep temporal fossa. In terms of treating the mid-face, usually we would start in the lateral treat to try and create the lateral support to improve the medial cheek and the lower face. But in Kelly's case, what I'm actually going to do is start by treating the medial cheek. Because she has very well-defined cheekbones, I don't want to risk over-volumizing this area and then requiring more volume here to create a nice natural contour. I really want to start here in the medial cheek before I come to the lateral cheek. In most cases, I would take all the markings off, but in this case, I'll leave them on, but I'm not going to treat through a marking, ensuring I treat through a clean area of the skin. We'll be treating the medial cheek or medial soothe with a cannula. I like to use a 25 gauge 38mm cannula, and again we'll be using RHA4. Now in this area it's important to consider the amount of volume you need to use and where. Again, I'm going for a deep plane. I don't want to risk product going into the superficial nasolabial fat in case I create a worsening of the nasolabial fold. With the cannulas will come your needle introducer. You want to get it to approximately the plane you want it to be, because if you don't go down deep enough, you will risk allowing your cannula to glide into a superficial plane. So now with the cannula, I'm going down to bone. Again, I want to be targeting the deep fat pads. And I always place my finger on the orbital rim because I want to make sure that I'm staying inferior to that, and I place my other finger medially to ensure I don't go too medial, and I can identify at what level I am. And I know I'm deep because if I raise up the cannula, I don't see the actual cannula through the skin. The key to injecting from my perspective is slow and steady always, never be in a rush to do these kind of procedures, and ensuring I don't go into any superficial fat compartment. So far the speed of my injection is so slow I've actually only injected about 1 mil. I'm going to reassess. That's just 0.2 mils in total into the medial soothe. Now, after reassessing Kelly and remarking the lid cheek junction, I feel a little bit more could be done. Again, making sure I'm deep, and I know I'm definitely deep there. Finger medially this time. I'm just going to feel very subtly, very slowly. Bearing in mind there's some important structures, despite using a blunt cannula, that's why I'm going nice and steady. Now the beauty of using a product like RHA4 is, despite it being resilient and having strength, I know I can massage this medially and I can feel it under my fingers, moving it into exactly the position I want it to be, to feel the medial soothe. And sometimes all it requires is very gentle manipulation, nothing too drastic. So just by using 0.35 mils of RHA4 with a cannula in the deep fat plane, filling up particularly the medial soothe, as we like to call it, we can already see an improvement in the lid cheek junction on the right hand side, which has moved up, versus the left hand side. This hasn't required any use of tear trough filler, but just volumization of the mid-face, showing the impact you can with just a small amount of filler in the right place. So with just 0.35 mils of RHA4 with a cannula into the deep fat plane, which in this case is the medial soothe, we can already see an improvement in the lid cheek junction, which has moved upwards, versus the left hand side, which is still inferior to that of the right. This is without the use of any tear trough filler, despite there being a tear trough, which has seen some improvement just with volumization. Now, the important thing to do whenever volumizing the face is also analyze it on animation. So Kelly, if you could give us a smile. And you can see there's no impact or no unnaturalness to when Kelly smiles and relax. And importantly, despite treating the mid-face, there's no worsening of the nasolabial fold on the right-hand side. And in fact, by treating just the medial cheek fat and the medial soothe, we can see an improvement of the right nasolabial fold versus the left, proving that you don't need to treat nasolabial folds directly to improve them, as long as you're treating the right area of volume loss. Despite just treating one area of the mid-face, one other important thing to realize of using RHA4 is the amount of product that's required. I've used 0.35 in the medial cheek, which is a small amount when compared to other volumizers, wherein I may need to use a little bit more because of the dispersion of the products. I've found with RHA4 in my experience that it contains itself, but is also moldable at the same time, meaning I have more product to use elsewhere. So next we're going to treat the lateral mid-face, This is not to create any volume here, because as I said before, Kelly doesn't require it. What happens as we, over time, we lose volume, but is also the fact that the retaining ligaments of the face become a little bit lax. What I'm really trying to achieve in the lateral mid-face here is small amounts of volume or micro-volumization to strengthen those retaining ligaments to create some lift to the lower face. It's not going to change the way her cheeks look, it's just going to lend support. So I'm going to remove my markings and always clean and re-clean. So this is going to be a bolus, supraperiosteally, sharp scratch. Straight onto periosteum, aspiration, hold for a few seconds, and slow injection technique. Here I'm going to plan to use 0.1 is all I think that is required, because as I mentioned, she already has good cheek definition. Now you will see a small mound, which I will massage away, and I'll show you the benefits of using a product like this in being able to get rid of that. Now the second injection point, more laterally, I am going to use some lateral retraction because I want to pull these retaining ligaments up, again straight onto bone, and here going to tether the retaining ligaments with another small bolus, slow injection of 0.1 mil. As you'll see in just a second, is how I can mold these two boluses together. And you can see literally under my fingers how they are coalescing now into one bolus. I've used single boluses rather than a cannula in this area. It's because I want to be very precise where I place it over the periosteum. What you'll notice is that I'm not doing a formal massage yet. I will do a massage with some cream right at the end. This is really just to ensure my product sits in the right position for now. Now, as I said before, one of the benefits of finding a product that is dynamic and is resilient is being able to use it in multiple planes. Traditionally, we focus on using volumizers specifically at a deep level to potentially more superficial just in the cheek area. One of the benefits of choosing a product that is dynamic but is also resilient and has some stretchability to it is being able to use it probably just under the skin in the superficial fat plane of the lower face. Now this isn't to volumize, this is really to try and create some lift to try and improve the lower part of the face in this direction. In most cases with other volumizers you may need 0.5 to 1 mil to try and affect these results. I believe with RHA4 we can achieve this with a lower volume, and I've got 0.5 left in my syringe mounted on a cannula. I'm going to use a fanning technique with very small thread to try and create this, which I will then massage in. Sharp scratch. This time I don't want it to go deep because I want to go into the superficial fat plane just under the skin, laying fine threads. I'm going to let my cannula, and it should at this point slide through. If it's not sliding into the plane, the anatomical plane, you're probably a little bit more superficial than you want to be. Now the important thing when using cannulas is you can either do an anterograde or retrograde injection. I prefer to do a retrograde so I have precision over my linear placement. What I don't want to do is come back too far and keep depositing product right at my entry point because you may get a small bolus. The other thing when using cannulas is always bearing in mind that your finger doesn't touch the cannula. So again, very slow injection and linear threads. And I always like to check if my patient's okay. Kelly, are you all right?
Yes, good, thank you.
It can be a little bit, I don't call it uncomfortable, a little bit unnerving when you feel this sensation. So I'm stopping before I get to my entry point because I don't want to get a build-up of product. So that is a total of 0.4 mils of product. Now, to see the real results with fanning, I have to be able to massage this with some cream to get it into a position that will create that lift, and we'll see. I can immediately see how the superficial gel fat I have marked off has actually moved posteriorly. Now, massage is absolutely key. Spend your time or speak to your customers about the importance of massage and using a suitable cream. You do not want to do this without cream. It will be uncomfortable, but molding the product into the area you want it to be to achieve the outcome is absolutely vital. And I always reassess after massaging to see if I need to do a little bit more. We don't always get it right the first time, and we may need to use more product to get that result. And always massage backwards. No one wants things worsen because of massaging the wrong way. Okay, so that is now a total of 0.5 mils of RHA4 into the lower mid-face to create this lift. So we've treated now the right side of the face, a total of 0.35 in the medial cheek, a total of 0.2 in the lateral cheek, and a total of 0.5 in the lower cheek here. Now, what I can see already with, again, small volumes of product, we're not wanting to change Kelly. We're just looking for a very gentle rejuvenation and lift. Is the lid cheek junction has moved up versus the left untreated side. And we can actually see the bottom of the face, there's more of a squaring off of the posterior and inferior jaw versus the right side, which actually has a nice contour coming down. So the work we've done in the lateral medial cheek, but particularly here, has created that lift along here versus the left untreated side. So in summary now, we've treated the left side as well as the right side. All I've done on the left side is really just ensuring that I'm matching the symmetry of the lateral and medial cheek, ensuring I don't go too much into the superficial fat, and you can actually now see the left nasolabial fold has improved to the standard of the right, which we had improved beforehand, and some filler subcutaneously in the lower cheek here has improved the lower jawline on the left hand side.